As we know, in yesterday's class, we studied what is birth control and as well as what is the methods we will use to control, to prevent the unnecessary pregnancy or unwanted pregnancy. So, in that, we discuss four methods to control the birth rate. So, that is what birth control methods. So if I have taken in this, so birth control methods, the first method which we have been used that is that of physical barriers. So barrier methods. So barrier methods we are having two advantages. One thing, we can prevent the pregnancy, and as well as also we can get protection from the sexually transmitted diseases. And the second one is chemical methods. So these chemical methods, we are having two kinds of medicine we will use it. One is what, everybody? Oral consumption pills, or else the second one is what, everybody? First one is either oral consumption, second one is we will take through the vaginal consumption pills. So what will happen here? Oral consumption pills, basically we used to say that as a OC, that is what, oral contraceptive pills. Oral contraceptive pills. So these are the very effective method of preventing pregnancy. So as long as the women are taking the pills at the right time, so pregnancy will be prevented. It is just like they will not allow the egg, and egg is released into the oviduct. So no egg is produced by the ovaries of the female body, so that no fertilization will occur. That is why it is a very effective method of preventing pregnancy. But what will happen? Because of consumption of these oral contraceptive pills, so there will be a change of hormonal imbalance in the woman's body. So it may leads to many side effects. Okay, in future, if they their entire regular metabolism of a body will changes. So there will be a hormonal deficiency or hormonal imbalance in the body. So it is very important that if they are taking this hormonal oral contraceptive pills, they must be having a proper doctor advice. Like that is what prescription of doctor, we have to check out. Regular checkups with the doctor is compulsory. Next one, vaginal pills. So this vaginal pills is nothing. So what will happen? They will kills the. This will be related to the egg. Like means woman's egg. It can be prevented not to release into the oviduct. No matured egg, not releasing into the oviducts. So these vaginal pills, what they will do? They contains the spermicides, means the chemicals which can kills the who or which whatever it is. So which can kills the what, everyone? Which one kills the sperm? So that is what we used to call as vaginal pills. So these oral contraceptive pills is the most effective method for preventing pregnancy alone. But in this method, STDs, sexually transmitted diseases, can be spreading from one, like male partner to female or female partner to male. Next, third method is IUCD, that is what, intrauterine contraceptive device, which is also we can say copper T method. So this copper T, a well-experienced doctor or uh, whomever it is, a trained person who is having a good experience in this, just they will implant a device inside the uterus. So what will happen? Fertilization occurs after mating. Egg will release, sperm will reach to the egg, and fertilization occurs. Zygote will form, embryo will form. But after formation of embryo, the fertilized egg will come to the walls of the uterus. So for what purpose, everybody? It will come for the walls of the uterus. For what purpose? All of you, please respond. So yeah, so for the purpose of implantation. So during the time, so implantation time, so what will happen? These copper T prevent the implantation. So prevent the implantation means it won't allows the fertilized egg or embryo undergo the implantation on the uterus walls, so that what will happen? no implantation occurs. So again, it will be leads to prevent the pregnancy only. But here, what will happen? It cannot protect from us sexually transmitted diseases. So if any one of the partner is having, definitely it will be spreading to the another partner. So in a copper T methods, only it will prevent the implantation, not preventing the egg to release or not preventing sperm to meet the egg. So just it will prevent the implantation. So that what will happen? It will be like best method. It will be used to prevent the unwanted pregnancies. We can use this one. Next, fourth one is actually surgical methods. So these surgical methods is for male as well as female. So male, what is the part we people will cut? A certain part of the male reproductive system will cut it. What is that, everybody?
Vast.
Yeah. So vast difference. So vast difference, we people will cut a certain portion of the vast difference and will make a tied both ends so that no sperm will be released. Of course, sperm will generate, but it cannot be carried out and it cannot be ejected to the female reproductive system. So that is what we will cut a particular portion of the surgical operation. With the help of surgical operation, a particular small portion of the sperm duct or vas difference will be cut and both ends will be tied. So this is the method we used to call as, what we used to call, everybody? Vasectomy. So cutting the small portion of the sperm duct and tying it so that no connectivity of carrying the sperms. So that is what we used to call. Next one, are females we can do it. So female, what we can do? Fallopian tubes, or we can say oviducts. So oviduct, same thing. We people can cut with a surgical operation a small portion of the oviduct, or the fallopian tubes can be cut and both can be tied. So this both oviducts both can be tied in the ends so that what will happen? No egg will be contacted with the sperm. Sperm cannot reach us to the egg so that it will leads to stop the pregnancy. So this is what tubes we are cutting, fallopian tubes. That is what we used to call as tubectomy. So these are the four methods which we have studied to prevent the pregnancy. And there is another method which you have not. So that is what we used to call as corrective methods. See, remember, this is actually permanent. Sorry, this all can be, if you want, you can get the pregnancy again. First three, these three we used to call as like we can say contraception methods. Only just if you don't want, you can prevent it. But if you want again the pregnancy, you can. But last method, if you have taken, this is irreversible method. So means once you have been undergone this one, it is impossible to get the pregnancy again. If you want, it is not possible to get it. So that is what we used to call as irreversible methods. So which is, what is that? Surgical methods. So surgical method is the irreversible method. Vasectomy is for male and tubectomy is for female. That is what you have to remember. Now, there is another kind of method which we used to call as corrective methods. Okay. So what is this corrective method? See, first three we used to call physical barriers, and we can use chemical methods. So, or else we can say copper T. These all are actually contraception methods. Contraception methods. Okay. So now, if you have taken here corrective methods means we will undergo MTB. MTB means medical termination of pregnancy. So there is a word which you people may heard in our normal news or somewhere here and there. We people can heard this word. Anybody? Medical termination of pregnancy. Yes, please. That is what we used to call as, yes, please, abortion. So abortion is the next method of preventing the unnecessary birth to the baby. So that is what it is only done by well-trained, qualified doctor. So you cannot do by any, like we can say individually, they cannot, nobody can do. Only a well-qualified medical trainer can undergo this MTP. That is what medical termination of pregnancy. That is what we used to call as abortion. So abortion is a method by which pregnancy can be terminated by using a mechanical method. That is what, with like a surgical, they will be removed, or they can be removed by using the hormones. So that is what, there is a many tablets or something which you put the tablets, it will be like, it will leads to be bleeding. That is what menstruation will happen. So, but you have to remember, this MTB should be considered as the last step to be taken, because if you have been missed all these contraception methods, still there will be a chances of pregnancy. Then you have to go for this, because there will be extremely side effects if the female body will undergoes this abortion. So many changes will take place in the female body. They will face a lot of difficulties in the female body. So that is why it is not actually like suggested by any kind of medical advice which is undergoing the MTPs. So it is very, very dangerous also. So that is why it has been taken. It should be taken only in the case of emergency, or if there is an evidence of genetic disease or anything. So like first scan, during the first scan, 45th day, the fetus is supposed not growing properly. There is no heartbeat, or you can see up to 5 months pregnancy, it can be possible. Once it will cross the 5 months pregnancy, it is impossible to do the correct this MTP also. That is what medical termination of pregnancy. If there is evidence of genetic like any diseases, or by that time they will remove the fetus. That is only we used to called as termination of pregnancy, MTP. Okay. So, but this abortion can be legally permitted only within the 5 months of pregnancy. That is also by trained doctor. That is also with the help of like husband's consent. That is very necessary. Without a husband's permission, it is nobody can do. It is illegal completely. To, and it is a request of mother. That is what request of the female. Even husband's consent is necessary for this. That is only when only it is any genetical disease is there, or else if there is a problem, then only it will undergoes this one. So that is what is MTP. Corrective methods will use it. Okay. Now, so this is what is all about the methods. I will send you the photo of vasectomy and tubectomy, how it has been done in the female body and as well as male body. You can learn, that is also photo. You can see and just see the pictures. So it will be very simple. So that is the pictures which will speak about vasectomy and as well as tubectomy. So you can notice it there how they have been cut that pictures. You all can notice it. So it is just you can see. Have you all noticed the picture? All of you? Yes, please.
Yes, sir.
Yeah. So that's all it is all about. So you can see that. So they are just cutting the vasectomy. So that what will happen here? So it will be 1 minute. So you can notice it here. So at this region, they're just cutting the vas differences, certain region, and they are putting a knot. And here also they are putting a knot. And female also, this is what we used to call as vasectomy. And here tubectomy, what is happening? In tubectomy, what is happening here also? The tube. What is a tube? Fallopian tube, or we can say what is another name? Fallopian tube should be
Oviduct.
called as what?
Oviduct.
So
Oviduct.
certain reason they will cut and they will put a knot. They will tie it in the both the ends so that no sperm will enters Here also same thing. Here also no sperm will be carried further to eject into the female body. That's all it is. So this is what is a permanent method. It is irreversible surgical method. So it is impossible to get back the pregnancy. But if a doctors will fail to do the operation, there is a cases. Even I used to notice in my village. So there is a cases if this operation has not been done properly, understanding. So during the surgery time, there will be a mismatching of the surgery. By that time, there is a chances of getting a pregnancy. There is many cases, even in our India. So who has been got the pregnancy, even though they have been went with the operation. So means the operation is fails. If it is not has been properly, then there is a chances of getting pregnancy. That is what you have to remember. Now, so this is all about the contraception methods and how to prevent the pregnancies and all. So the best method to prevent the pregnancy is the physical barriers, and as well as also it will help to not to acquire the STD, sexually transmitted diseases. Now we are going to discuss the next concept is so female feticide. So this is the most terrific thing which is happened even now this century not. So basically, if you go to 2 decades back, like 2010 before, like before 2010, I means exactly like your birth time, almost imagine like, okay. Yes, Hasini. Because, yeah, very good question. So you observe very carefully. Just a minute. Hasini is asking a question. If the tubectomy has been done, is it menstruation will be takes place? Yes, it will be takes place. See, remember, menstruation will takes place. Either the egg will release or not, doesn't matter for us. Do you understanding everybody? So egg will come or not, doesn't matter. So actually menstruation means what? The uterus walls will become thickened. It will be completely filled with the blood cells, so that the thickness of the blood will be increases, because what? The system, the uterus will be ready to be waiting to receive the fertilized egg. So that is why every month it will be forms the uh, thickening the walls with the help of blood cells. That is what make it very soft and rich enough with the blood, everything. So what will happen? There is no egg will come, fertilized egg will come. There is no kind of implantation. So what will happen after certain days? It will breaks, so that it will leads to menstruation. Again next month, again it will form. Again it will be no egg will, fertilized egg will come. So that it will continuously, that process will takes place. So if tubectomy is done or not doesn't matter. Fertilization keep on occurs. That's all it is. Sorry, menstruation keep on occurs. Understand? Everyone, because menstruation means the blood which is present on the walls of the uterus, the tissues which are formed at the walls of the uterus, that is actually the menstruation. It's not that egg, it is alone is menstruation. So egg is there or not doesn't matter. Many girls, many women is having the infertility problem, but still they will get the menstruation. How it will be? Egg will release or not doesn't matter. They will get the menstruation because the walls of the uterus, the blood which is formed on the walls of the uterus will break, so that it will come in the form of menstruation. That's all it is. Understand everybody? All of you? So the next major issue in every throughout the world is actually the female feticide, means killing the female fetus. So actually during the 90s, 80, you might be go any kind of fertility hospital. You might be see the Act 1994. According to the 1994 Act, sex determination is not allowed. It is completely illegal. You might be notice every hospital, every fertility hospital, there will be a message in the walls. Everywhere throughout the India, you can go. Of course, in US, it is legal. Okay, US we can determine the sex, because there is no kind of female feticides. In India, particularly, it is banned during the 1994 according to the Act. So our government has taken many steps to prevent this prenatal sex determination. It is very, very illegal, but of course, still today it is happening. During this 1980 and 2010, between that, imagine that every month like lakhs of female feticides has been taking place. Means a sex determination has been done. So many people, if they will identify that if there is a girl baby inside, sex determination basically will be done by ultrasound. So we'll study in physics ultrasounds. With the help of ultrasound, we people can identify either it is a like the sound frequency range. We can identify either it is a male boy or like male baby or female baby. So for basically with the help of this one, many hospitals illegally they have been identified sex and they have been undergone abortion for many things. Many people even till today it is happening extremely because of boy. Everybody wants a boy, but it is not good for the healthy society because it is very necessary to maintain the female and as well as male ratio. So male and female ratio, sex ratio has to be maintained properly. Then only it will be like a proper society maintained adequately. Otherwise, what is happening? So still today in our society, the sex ratio is extremely different. Even till today, the Indian sex ratio is 1,000 men's, only 926 women's are existed, like birth ratio. So that is the sex ratio, male versus female sex ratio is that much, almost now 900. But of course, nowadays it is again growing because female feticide is completely restricted by the government and many steps they have been taken. So the sex ratio is declining. It is indicating that like uh, imbalance society. It is very, very dangerous actually for the society. So that is why daughters are much better than, like we can say, there is no difference nowadays. Many government schemes also there is no difference between the male and like a daughter and son. But of course our Indian society is like giving priority to the male boy compared to the female. Like something they'll say like my family, my genes, like something, many things. So they are what they are doing. They're like we can say like unless they will get the boy, they will keep on undergoing the female feticides. They will like it's very, very bad actually. So the daughters are even also equals to the men. So they are not no less than the boys. So that is why our government has taken many steps to prevent this prenatal sex. Means what do you mean by prenatal sex? Means identify determination of sex before birth. That is what we used to call as prenatal sex. So it is completely illegal. Abortions also completely illegal. Without a proper reason, nobody can. That is what genetical disease or some other thing or before mature days. That is what we can say. We can say they are majors. Under 18, we used to call it as minors. So under 18, if unfortunately, if anybody will be get affected with the pregnancy, so during that time, like we can say under the presence of police, this all the things they will undergo with the abortions. So to fight against this practice of female feticide, so even our country is started a social initiative called, like you can see 2015, India government has been bought many schemes like Save the Girl Child. So this is the even with this tagline, so there have been started many schemes like Beti Bachao, Beti Padao. Now you can see that Sukanya Yojana, this, that, and all, many things is taking place. So that is why Save the Girl Child with this the most famous scheme throughout the world, many countries has been inspired and they have been implemented. That is what Beti Bachao, Padao. So that is what is the scheme, which is a government of India scheme launched by PM Prime Minister in 2015 actually. So up to 2010, like imagine almost like I think you are all born in 2009. Am I right? Many of you 2008 and 2009. So imagine the period of 1980 to 2000 is extremely worst situation in India. Like every corner of the India, every village, everywhere, people used to undergo this female feticide. Many girls, like they never seen the world in a mother's womb, like 3 months, 4 months itself, they have been killed this. That is what the government has been bought Act 1994 is illegal, completely illegal in the sex determination. So you have to remember that a male or female doesn't matter. Both are equal. Always, nobody is supposed to encourage this female feticide. That is what you have to remember it. That is also just awareness they are creating. Now there is a 2 questions from Omar. First one thing. Omar, what is your question? Yeah. So, sir, can we stop the production of sperm permanently, except vasectomy? It is not possible, Omar. So, but the problem is, you remember, unless, see, during the copulation time or during the sexual meeting with the female, so only the sperms will ready to enter into the vascular difference. Then only the penis will become erect. Erect in the sense of it will become uphold. So that by the time only the production of sperms will be takes place. Unless the penis will become erect, it is not possible to produce the sperms. Do you understand, Mr. Omar, what I am saying? Clear? So it has to become stiff enough to ejaculate the sperm. So if it is not become stiff enough, so it is not possible to release the sperms outside. So that is why it is not a problem. Next, so during menstrual cycle, can women get pregnant if it will be whether offsprings will form or not? Sir? Not possible, Omar, because menstrual cycle itself, it is failed fertilization. Either fertilization fails or egg is not released or the sperm is not fertilized with the egg. So there any possibility. So it is not possible to get the pregnancy during the menstrual cycle. Are you clear? Yes. Next, Gayatri asking, sir, is then there could be chances of killing the born girl child after the birth. Many cases, Gayatri. So throughout the world, till today, it is happening. So, but of course, many countries, if you go to America, so you can, by the 3 months itself, you can identify either you are going to get a male boy or female, like female baby or male baby. It is legal there because there is no feticides cases like killing the baby, girl child, so that parents can identify child who can born, like who is going to get like male or female, they can identify. But in India, it is not possible. So because it is India, many things adverse, like worst things has been experienced by society. That is why it is completely illegal. Okay, everybody, clear? All of you, please respond. That is what is about. Anybody doubt? You can still you can ask. You can ask. Mr. Omar, are you clear? What is that? Yes. So next one, sexually transmitted diseases, STDs. So this is the last second concept. So sexually transmitted diseases. So these are the diseases only transmitted from an infected persons to the uninfected person. So if in a pair, because a male or female, an infected person to a healthy person, when they will sexually contact, that is what we used to call as STDs. So infected persons to a healthy person during the sexual intercourse. That is the diseases we used to call as, what we used to call, everybody? We used to call as STD, sexually transmitted diseases. So here you can see, they can be like STDs can be bacterial or viral, whatever it is. So if you have taken bacterial or viral, even yesterday I have taught you the diseases names. So gonorrhea, if you can take it, this is the most common disease, basically will be happen in males actually. So gonorrhea and syphilis, both actually they are the bacterial diseases. Please note it. They are the bacterial diseases, and you have taken VATS. VATS is also one of the sexual disease, and HIV/AIDS. HIV/AIDS are the viral infections. Okay, so please note it. So this is what is about it. So now the bacterial infections basically causing burning sensation. So at the region you can keep on getting itching. It will be like painful burning sensation. So even while you are passing out the urine, if you go for urination, so basically you will get the burning pain, like you can experience the like something is very like uncontrollable pressure it is. So that is what it will be. So basically you can get this source in the genitals, like you'll feel like uncomfortable. Wearing dress is also very tough. It is that that reasons and all every that all the genital areas, you will feel like acne and the sores in the genitals. So these infects are very curable, and they can be prevented by just using avoiding multiple sex partners, using appropriate barrier methods, by taking antibiotics or appropriate medicines at the proper time. So these are the methods we can control this kind of diseases. Which one? Gonorrhea and as well as syphilis. So syphilis, this like we can get during the urination time. Just will feel like pain, like urethral discharge or sores in the genitals. That is all is the symptoms of these diseases. So it is very simple, curable diseases. So no need to worry. Just you have to avoid multiple sex partners using appropriate barrier methods. You can use condoms or whatever it is, and you can take antibiotics frequently. It will be stopped. That is what is about this. Just normal. It is many kind of people can experience it, but viral infectious diseases. So it is like most notorious disease. So you can imagine like notorious criminal. Most notorious disease is actually HIV/AIDS. That is what we used to call as acquired immunodeficiency syndrome. AIDS is the permanent disease. Once it will be acquired, no person can be survived till today. Within a span of time, within a 1 decade, 10 years of time, the person will undergoes death 100%. That is what is happening till now. There is no kind of medicine for this, because this virus is the most mode of transmission virus. Means there is no proper structure of HIV virus till today. Every minute, every second, the DNA structure of HIV is keep on changing. So it is impossible to identify or develop a injection against or medicine against to this HIV/AIDS virus. So that is why whole world is struggling with this AIDS disease. So even India, it is in world second place in sexually this AIDS cases, because of awareness, in awareness. People does not have proper methods to use to prevent it. So many ways. So this AIDS is actually usually sexually transmitted disease, as it is can pass from one person to another during the sexual intercourse. But it is not always 100%. So be very careful. That is the reason there is a many cases. I think my phone is also there is a case in Uttar Pradesh. Two doctors has been infected with the HIV because they have been got the only the person who is having AIDS, they used to have the, you might be noticed, I will send that. So in Hyderabad also, two young twins doctors, they have been infected with the HIV, but they do not have any sexual contact with anyone. They do not, just they are MBBS completed graduates. But what is happened, they used to have the Pani Puri every day in front of their AIMS Hyderabad. And the person who is having AIDS, the Pani Puri seller, so they have been struggled throughout, like around 2 years. They have been investigated all the relatives, this, that, and all, every corner who is having this AIDS, how they have been infected. At last, they have been identified. The person who is selling the pani puri, while cutting the onion, unfortunately, his skin has been cut, and the blood